In today's world, many of us look to GPT or generative pre-trained transformer models to answer our questions. However, the facts presented by these GPT platforms may not always be accurate. As a breast surgeon who does my own research and studies the outcomes of the patients I personally treat, I was interested to know what information GPTs are disseminating to those who ask questions online about treatment options for breast cancer surgery. So in January 2026, I posed a question to a very well-utilized and popular search engine which relies on GPT to answer questions. The question was, which operation is best for early-stage breast cancer, lumpectomy or mastectomy? As we see, in the first sentence of the answer, the reader is told that neither surgery is objectively better for early-stage breast cancer. I wish to make it clear now that this statement is not supported by expert opinion. I have discussed this first statement by GPT in some detail in another video. The link to that video is listed in the comment section below. Suffice to say here that at the 2025 edition of the St. Gallen International Breast Cancer Conference, a panel of experts state that breast-conserving surgery and radiation therapy is usually the best treatment option. That said, in this video, I would be discussing something slightly different, and it pertains mainly to what GPT said in another part of the answer. In this later section of the answer generated by GPT, it was stated that some 2026 data even suggest lumpectomy plus radiation may offer a slight survival advantage for certain subtypes compared to mastectomy alone. While it may seem convincing, this statement is incorrect on two fronts. What are these two inaccurate points which GPT has made? Let's find out. Before we move on to look at the evidence, let us define the options for the surgical treatment of breast cancer. Surgery for breast cancer can be broadly classified into two categories. The first option is breast conservation treatment. This involves surgery which completely removes the cancer with a rim of normal tissue around it. It is usually followed with radiotherapy to the preserved parts of the breast. This operation has many names and may be referred to as breast-conserving surgery, lumpectomy, wide excision, segmental mastectomy, or partial mastectomy. The second option is broadly termed mastectomy, which is the surgical removal of the entire breast. Women may choose to undergo reconstruction after a mastectomy. It is true that at one point in time, breast conservation treatment was considered to offer similar survival outcomes. In 1991, this consensus statement was released by the National Institute of Health in the United States. It is asserted at that point in time that breast conservation treatment was preferable because it provided survival rates equivalent to those of total mastectomy while preserving the breast. However, that is no longer true today. Let us look at this data which was published in 2007. This study, led by Dr. Martin, looking at 3,000 women who were treated for breast cancer between 1st January 1995 and 31st December 1999. Based on the statistical analysis, it was found that Western Australian breast cancer patients treated with breast-conserving surgery have improved survival outcomes over those treated with mastectomy. In 2014, this article from the Department of Surgery at the University of Michigan was published after a careful study was conducted on the results of 132,149 patients, concluding that patients who underwent breast conservation treatment, or BCT for short, have a higher breast cancer-specific survival rate compared with those treated with mastectomy alone, or mastectomy with radiation for early-stage invasive ductal carcinoma. This article, entitled Breast Conserving Surgery versus Mastectomy for Non-Metastatic Breast Cancer, a systematic review and meta-analysis of observational studies, was published in 2025. Systematic reviews and meta-analysis are methods used by doctors to collectively analyze multiple studies already available in medical literature to evaluate the validity of the data. This study demonstrated significant benefits of breast-conserving surgery on overall survival at both 5 and 10 years after treatment. By now, you would already have concluded that the first error that GPT made in answering this question was stating that both lumpectomy and mastectomy offer identical long-term survival rates. We have already seen the data from several studies demonstrating that BCT results in better long-term survival outcomes than mastectomy. Moving on to another section of its answer, we find GPT stating that recent studies show that survival outcomes for early-stage breast cancer are similar for both procedures. I have already discussed that there are studies which date back to as far as 2007 showing improved survival outcomes with BCT. Considering that this question was answered in 2026, knowing the data demonstrating better survival outcomes with BCT since 2007, I can confidently say that evidence has been available for 19 years and is certainly not recent. Therefore, the comment by GPT that recent studies show that survival outcomes are similar is incorrect. Based on what we have just discussed, this statement that some 2026 data even suggest lumpectomy plus radiation may offer a slight survival advantage for certain subtypes compared to mastectomy alone is also incorrect. As we have already seen, there is evidence dating back to 2007 which shows a survival advantage with BCT compared to mastectomy. Having pointed out 3 imprecise statements already, I wish to dissect this statement by GPT a little further. Here is a claim that there is a slight survival advantage with lumpectomy plus radiation. To address this GPT statement of a slight survival advantage with breast conservation, I would like to present 2 articles. This first publication was the results of a study done in Norway. The analysis revealed a 1.7 times higher risk of breast cancer death among women who underwent mastectomy compared with BCT. That means women undergoing mastectomy had more than 1.5 times the risk of dying than if they had undergone breast-conserving surgery. Would you consider that a slight difference? Please leave a comment to let me know what you think. In 2022, this international team of doctors studied the outcomes of more than 1,800,000 patients. They noted that breast-conserving surgery is associated with improved overall survival compared with mastectomy. The RR, or relative risk of dying with BCS, was 0.64. In other words, the likelihood of a patient meeting her demise from cancer after breast conservation was 1/3 less than if she had undergone a mastectomy. As we have seen from these 2 studies, breast conservation treatment results in at least 30% better survival rates compared to mastectomy, and this improvement cannot be considered slight. In summary, therefore, in answering my question, GPT has made at least 3 imprecise statements, if not more. My concern is that women may be misinformed at crucial treatment decision moments. Hence, my aim in producing videos like this one is to increase awareness of the actual research data to empower women to make decisions that help them live longer and live more after breast cancer treatment. For full disclosure, this video is created with assistance from artificial intelligence. However, the studies have been searched out and reviewed by a human surgeon. The references of all the published data is provided in this video, and I encourage everyone watching to verify them for yourself. Should you wish to discuss these further, please enter a comment or submit a request through the Just Medicine website. I will be happy to answer your questions about the evidence to the best of my ability. Thank you for staying until the end of the video. As always, kindly like, share, and subscribe if you have found the information useful. Please also let me know in the comments section if there is any other topic on breast cancer surgery for which you would like me to discuss the available research data. In addition, there are many other videos in this channel which cover more information on breast cancer surgery, and I hope you will join me in those episodes as well. Until we come together again, take care.